Greetings, fellow Ugandans. Adiri Days is my name, and I'm the 35th UNSA Vice President. As we may all know, May is Hypertension Awareness Month, and for the 8th edition of the UNSA Weekly Health Bulletin, we'll be discussing one of the complications of hypertension, and that is stroke. Cardiovascular diseases are the leading causes of death globally, with 80% of the deaths occurring in low and middle-income countries. As of 2025, hypertension, the leading modifiable risk factor for stroke, affects over 125 million people in sub-Saharan Africa. Uganda, stroke is the 5th leading cause of death, with over 50% of the patients having a history of hypertension. Now, poor adherence to the prescribed antihypertensive medication and uncontrolled hypertension contribute significantly to the rising cases of stroke in Uganda. Stroke refers to the onset of neurological dysfunction that is caused by either an interruption of blood flow into the brain, that is for ischemic stroke, or bleeding into the brain, and that is for hemorrhagic stroke. Various causes of stroke in our society, and these include 1. Uncontrolled hypertension. Then we also have poor adherence to prescribed antihypertensive medication, untreated or undiagnosed high blood pressure, smoking or excessive alcohol consumption, dyslipidemia, that is too much fat content in blood, obesity, other cardiovascular diseases such as diabetes mellitus, and finally, sedentary lifestyle that is characterized by lack of physical exercise. So a key thing to note, uncontrolled hypertension, poor adherence to prescribed antihypertensives, and undiagnosed hypertension are still the major causes of stroke in our society. The signs of stroke include severe headache, sudden weakness or numbness in the face, arms or leg, especially on one side of the body, difficulty speaking or understanding speech. Then we also have loss of vision or blood vision in one or both eyes, sudden confusion or disorientation, loss of balance, and at the worst of it all, loss of consciousness in severe cases. It goes without saying, prevention is better than cure, and this is how we can prevent stroke in our settings. 1. Regular blood pressure checks, especially in adults above 30. Adherence to the prescribed antihypertensive medication. Increased physical activity or exercise, at least 30 minutes daily. Have a healthy diet that is low in salt, sugar, and fats, but rich in fruits, vegetables, and whole grain. Last but not least, avoid tobacco and alcohol consumption, and do regular screening for diabetes and cholesterol levels. I hope you learned something new today, and see you in the next bulletin.